A lot of people have a splint. It is a small wire that is fixated behind your lower front teeth after you've had orthodontic braces or when you have loose teeth. The goal of the splint is to fixate the teeth, but the splint does come with a problem. In every mouth, dental plaque forms after some time. Dental plaque can be easily removed by brushing your teeth often, but when it is not removed completely, the plaque can calcify and form calculus. This issue mainly occurs around the dental splint. The structure of the splint can make removal quite hard. The calculus around the splint could then cause severe problems such as periodontitis, which can damage the soft tissue and destroy the bones supporting your teeth.
But what exactly is dental plaque? And what is the problem?
Your mouth is the perfect environment for bacteria to thrive. It's warm, it's moist, and there are enough nutrients to go about. This is why a clean mouth will even have between 50,000 and 100,000 bacteria per tooth. With lacking hygiene, this number can go up to 1 billion per tooth. Most of these bacteria are harmless or even necessary for your digestion, but one bacteria in particular is not, the Streptococcus mutans. This gram-positive bacteria can easily live in your mouth. It can withstand anaerobic conditions and it creates an acidic environment around itself to thrive even better, while making a less favorable environment for the good bacteria. The Streptococcus mutans, like other bacteria, form something called a biofilm. After adhesion of the bacteria to a surface, it changes some of its behavior, and it starts producing slime. This slime will facilitate adhesion for more bacteria and a microcolony can form. This colony can then grow bigger and eventually become a fully fledged biofilm, dental plaque. This can then calcify and form calculus.
So what are the consequences of this dental calculus?
Dental calculus contributes to the development of periodontitis. The calculus, formed from calcified biofilms, is a very suitable breeding ground for new biofilms. Today, one of the most important objectives of dentistry is the removal of dental calculus. In 2010, a global health study estimated that about 750 million people suffered from chronic periodontitis. Splints have been shown to increase dental plaque and calculus.
What is the current treatment?
Plaque can be mechanically removed by brushing, flossing, and using mouthwash, and the dentist can remove calculus for you.
Okay, how can we improve on this treatment?
The easy answer to this question is to brush and floss more and better. We could also make it harder for the bacteria like Streptococcus mutans to survive on the splint. To know more about the growth of the biofilm, we went to the expert, Brandon Peterson. We know S. mutans thrives in a low pH environment. Can we use a surface or material which alters this?
Your diet influences the pH constantly. Besides, S. mutans creates its own low pH environment.
Splints are made from coiled metal threads. Can we change the thickness of the metal threads to change the adhesion properties?
This will alter some adhesion, but it won't be significant. Make sure you don't alter the strength of the splint.
Can we coat the splint with a polymer to affect the adhesion?
You could, but polymers won't connect to metal that well. A long-term solution would be a strong surface topography.
A long-term surface topography that inhibits adhesion. Any suggestions?
Ask Patrick, he knows everything about nanotopography.
Our teacher tipped us about cicada wings. The surface of cicada wings has very small spikes or nanopillars, about 100 nanometers, which literally pop gram-negative bacteria. However, our plaque-forming bacteria S. mutans is gram-positive. Dragonfly wings kills both gram-positive and gram-negative bacteria by using even smaller nanopillars of about 30 nanometers.
Cool, but how do you apply this to the dental splint?
Nanopillars can be made from transition metals such as copper, tin, and silica. This technique might also be used on our stainless steel dental splint.
Okay, so what is the overall conclusion?
A nanopillar topography on the splint will create a long-lasting gram-positive bacteria-killing nanospike surface, which will make it harder for the biofilm to form. This will reduce dental plaque formation and avoid cases of periodontitis. There are some other things we have to consider when doing more research. Firstly, the nanopillars are only fabricated on gold and glass surfaces, and tests have to be done to grow these pillars on the nickel/chrome composition of the splint. Secondly, while these pillars are quite strong, they still have to be tested if they can withstand the eating, brushing, and flushing forces they are exposed to in your mouth. Lastly, the price of this coating has to be considered. A lot of things have to be investigated, but we think this is a very promising solution for the dental plaque problem around the splint in your mouth. Thank you for watching.